In a small community hospital, I began working 30 years ago as an auxiliary nurse. Much to my father's amazement, he always said, "You'll never be a nurse because you can't stand the sight of blood." But actually I did become a nurse, and actually I'm not afraid of blood, or worse. In time, I began to be aware of the differences and the inequalities that existed between our Western health facilities and those of third world countries. I wanted to understand the wider needs of people of all backgrounds. In 1991, I travelled to Calcutta in India to work in a street clinic for the destitute poor. In the really scorching heat, I cared for those suffering malnutrition, tuberculosis, cholera, but mostly Hansen's disease, which is otherwise known as leprosy. And also under Mother Teresa's guidance, I also worked in the home for abandoned babies called Shishu Bhavan, and Kalighat, which was the sanctuary for the dying. I'll never actually forget watching the missionary sisters at work. You know, one image that will stay with me forever is that of a sister washing a patient's soiled clothes by hand, under running water, whilst a rat scurried across the floor by her bare feet. Pushpa, she was a lady dying of tuberculosis, took my hand and held it to her forehead. She spoke only Hindi, and at that time I spoke only English and a few European words. We had a conversation about how her children had abandoned her outside Kalighat to die. You know, to this day, I really don't know how we talked to each other, but we were both richer, I think, for the few words that we shared. Now I've learnt those few words to offer patients in my care, though they sometimes laugh at my Hindi or Arabic accents. But it means as much now in Milton Keynes as it did with the dying lady in Calcutta. So if you'll forgive my accent, Assalamu alaikum, peace be with you.